When it comes to weight loss and weight management, a lot of people have a lot of questions, a lot of mechanisms, a lot of ways of losing weight. But the question I have for you today is that, are you doing the right way? The reason why Dr. Greg is talking about this is because of the current use of a certain medication known as semaglutide, into brackets Ozempic. I know most of you have seen most of your celebrities using this medication left, right, center, and hence everybody now wants to use Ozempic to lose weight. But now, have you forgotten that Ozempic is a medication? And before you use any medication, you have to confer with your healthcare provider before you use those medications. Now, a little background on this Ozempic whole issue. Ozempic is a medication like insulin. Ozempic is used in managing type 2 diabetes. And also it has an effect of causing a reduction in weight. And because people saw this, I know Amma, who has some body con, who wants to wear it, have now introduced a cure to it that yes, this medication helps reduce weight without doing exercise. I know all of you hate exercise, so anything that excludes exercise, you are in for it. Now, let me shock you that it's not everyone that can use Ozempic or semaglutide in weight loss. Now, number one, if you know that you have a family history of thyroid cancer, if you have a mother, a father, anyone who has had a history of thyroid cancer, please don't go near Ozempic. Also, if you are someone who has a family history or you have a history of pancreatitis, that's inflammation of your pancreas, please do not go near Ozempic. It's an exclusion for you, the individual. Also, if you are someone who has issues with your GI, your gastrointestinal system, if you have an issue with it, please, Ozempic is not for you. The reason is that Ozempic, as you guys see it, reduces your gastric emptying time. In simple terms, it means when you eat, the rate at which the food will have to leave your digestive system slows down. It means that you will be experiencing a lot of bloatedness, a lot of nausea, vomiting. And if you are someone who has a condition such as irritable bowel syndrome, IBD, maybe it can be Crohn's disease or ulcerative colitis. If you have this condition and please, you are someone who is obese and you go in for Ozempic, please, it is your own wahala. If you have gastrointestinal issues, please confer with your doctor before you even jump on this medication, because if anything happens to you, Dr. Greg, I am not there. Because there have been cases where people have reported with gut paralysis and gut paresis from Ozempic. It means they were okay until they started using Ozempic. Then they realized that they eat and now it's like the food is still in their digestive system, it's not getting out because it has slowed down the emptying of your gut. Then one last thing I have to tell you, that the weight that you lose with Ozempic, if you stop using the medication, you are going to get that weight again. And he said, oh, you saw Ozempic, now lose 20 kilograms, and you stop using Ozempic, trust you me, you are going to regain that weight again. But in all, my advice to you as your doctor, as your pharmacist, is that you confer with your doctor before you go in for any weight loss option, especially the use of Ozempic, because it is dangerous to use this medication like an over-the-counter medication. It is a prescription medication. Those who have been doing what ways and means to get it, if you get a side effect of it, please, it can be catastrophic for you. Don't put yourself in that dilemma. Speak to an expert, speak to your doctor before you go in for that. I know weight loss is a mission, but there is a right way of executing a mission. This is Connected Dr. Greg. Stay tuned for my next video. Like, share this video. Let it go into your church pages, everywhere. Let's meet again for our next discussion. Bye-bye.